Hello, Dr. Glenn, resident vet for Vet and Pet Direct, talking today about feline lower urinary tract disease, or FLUTD. A really common problem in cats, unfortunately, are urinary tract troubles. There's heaps of different acronyms and different names for different bits and pieces. Some cats with FLUTD, which is basically a combination of a number of different problems. Some are caused by feline idiopathic cystitis, which means we've ruled out everything else, we don't know what's causing it, it's idiopathic, we haven't got a name for it and we haven't got a cause for it, but it's happening. Some of them get feline lower urinary tract obstructive disease, which is mostly male cats. Because they've got a smaller urinary tract diameter, they get blockages more frequently. Female cats seem to be more prone to the cystitis side of things, but basically feline lower urinary tract disease is a really big problem. What are the symptoms? Basically, you can get more frequent urination, usually of smaller volumes. Sometimes that can be in the litter tray or where the cat normally toilets, and then often it becomes in other inappropriate places. It's essentially on flat surfaces. It's separate and different to marking, and marking tends to happen on vertical surfaces, but your cat will often start urinating the shower pan or the bathtub or the kitchen sink or the hand basin are common spots, but it can be on your favourite pair of shoes, in the back of the cupboard, on your bed commonly, the couch, all sorts of places that you don't want them to pee, and they probably don't want to pee either, and that's because it's uncomfortable and painful, so they're usually trying somewhere else. Not out of spite, but because it hurts to pee here, so I'm going to try somewhere else, and that's usually the story of what's going on. Other symptoms include actual blood in the urine or discoloration from pink right through to blood clots. Sometimes if you're observant or if it's on the right surface, you'll see like crystals, like a little sandy, gritty appearance to the urine. Definitely some cats will vocalise and basically it's quite painful to urinate. Sometimes you'll see an increase in water intake at the same time if they've got disease processes going on, and sometimes they'll actually stop being able to urinate. Male cats in particular, you can get obstructions happening from either crystals or like protein plugs, and the urinary tract actually becomes blocked, and that becomes a critical medical emergency. Your pet needs to go to the vet as soon as possible. So if you're not sure if your cat's urinating, get them to the vet as soon as possible, because we need to know if that bladder's filling and filling and filling, causes kidney troubles, bladders pop, it gets really messy. So that is very, very important. Other symptoms, you actually might see them grooming excessively down in their perineal area or around their back end, and that's a normal grooming behaviour, but if you're noticing it's happening more frequently, that can be a problem. And sometimes you'll actually see grittiness like sand, crystals there, or a bloody appearance as well. So basically, if any of those symptoms are happening, you need a vet visit. Which cats are more prone to feline lower urinary tract disease? Essentially, it's usually younger to middle-aged cats. We see it more in indoor-only cats or cats with limited exposure to outside. We certainly see it in cats that are overweight or obese more frequently, and we also see it in cats that do less exercise as well. Cats that eat primarily a dry food diet seem to be more prone as well, and we think that's mostly because in general of a lower water intake that's basically causing a more concentrated urine. Basically, when you take your cat to the vet, we're going to get a urine sample. We're probably going to run some blood tests to see what's going on the inside. There's a number of different contributing diseases that can be going on, and we need to get a diagnosis on, is there infection there? Infection's quite uncommon. Less than 10% of cats with urinary tract disease have actually got a bacterial infection happening, but the ones that have got it, you need to know about it. Sometimes there's cultures involved. The best sample of urine to kill from bacteria is direct from the bladder that vets can get via cystocentesis, a little needle into the bladder. The best urine sample to diagnose what's actually going on with the whole urinary tract is a voided sample, so collecting a urine sample after they've passed it, because that's telling us what's going on in the lower urinary tract as well. So often it's a combination of urine samples that we need to collect to get a full diagnosis of what's going on. So occasionally there's infection, sometimes there is a sterile cystitis going on, so you've got inflammation, basically like bleeding into the urine from the bladder wall that isn't associated with crystals and it isn't associated with infection. So that's the idiopathic cystitis side of things. Crystals are not an uncommon finding in cat urine. Lots of cats that have got cystitis symptoms have crystals in their urine, but not all cats that have got crystals in their urine have cystitis symptoms. It gets complicated. On average, the more concentrated the urine, the more likely crystals are to form, but there's lots of cats running around out there. If you get just random urine samples from normal cats, you'll find crystals in the urine. The urine, if it sits around on the bench, if you put it in the fridge, those crystals are more likely to form. So we've got to interpret crystals the same time as all the other things that are going on with the cat. Once you've got a diagnosis, if it's infection, okay, we treat it with antibiotics. If there isn't infection there, we don't treat it with antibiotics. If we've got inflammation and pain, okay, we're going to treat with anti-inflammatories most of the time. If you've got inflammation from cystitis, we're going to go down the path of, okay, what can we do about the cystitis side of things? 2/3 of these guys are idiopathic, as in there's no known reason, there's no obvious reason for what's going on. And when we say there's no obvious reason, it's probably we haven't cottoned on to what's going on. Stress is definitely a really, really big part of these guys' lives, and most cats with feline lower urinary tract disease, it's stress induced to some extent. And that doesn't mean that the cat has had an acute stress, grandmother visiting or children in the house all of a sudden, but cats' lives change over time, and there's lots of households where cat was in the house and children have arrived later, new dogs, new house, new circumstances, and we don't actually realise what's going on with the cat's life, but the cat's life's changed. So veterinary behaviourists have become more involved with the treatment and prevention of urinary tract disease in cats, just because there's a large amount of questions and a large amount of diagnosis that needs to go on with these guys to try and get to the bottom of the cause of things, because we can do dietary changes that can definitely help. We can do medications that can help, but if we don't relieve the stress in the cat's life, a lot of the times the situation will keep happening. Urinary dilution is always a big part of the treatment for these guys, whether you've got crystal formation, whether you've got active inflammation, or whether you've got infection. Having more dilute urine is always a benefit. Cats on dry food diets across the board never really make up for the lack of water in their food and will always have more dilute urine on average. There are prescription veterinary diets that are dry food based that are designed for cats with feline lower urinary tract disease, and those dry foods have got additives in them to either increase water intake through extra salt added. There's different composition where they've got less minerals to make crystals out of. A lot of them have got tryptophan and other anti-anxiety supplements involved in the food. On average, the same cat will be better off on the canned version of that food. Some cats don't like eating food other than what they used to, and some cats are addicted to the crack, which is basically they really like dry food. So there's dry food prescription diets that your vet may recommend. I would always encourage people to try and use the canned or the wet food variety of those, just because they're going to intake more water. You can give them more water points in the house. Water fountains, some cats will increase their water intake just because you've got moving water, more different water bowls around the house, preferably a shallow bowl without high sides so the cats can see while they've got their head in the bowl. Their whiskers don't touch the side of the bowl, which can irritate some cats. You can get flavoured water, chicken flavoured water and tuna flavoured water, which for some cats is a benefit and it can increase their water intake, but definitely the more offerings the better. And food-wise, most cats will tolerate additional water, even with wet food, that can dilute the food more, and that's of benefit as long as it doesn't reduce the cat's appetite in general. And even dry food, you can soak it as well, and that can help increase the water intake, which is critically important to just dilute everything. If you've got cystitis that's idiopathic, the less concentrated urine that's against that bladder wall, it certainly helps, and crystals are less likely to form if you've got a more diluted urine. The next main thing that we do for cats is stress relief, and that can take a number of different forms. It's a really big topic, but cats in general, if they've got more high perching areas in the house that they can get up and away from other cats or other dogs, or just have a higher outlook on life, that helps. If you've got a multi-cat household, having different rooms that they've got access to. We definitely see less urinary tract troubles in cats that are outdoor cats. Is that because they've got access to dirt where they can just urinate more frequently? Maybe. Is that because on average they do more exercise? Maybe. Is it because they've got less stress in their life? Maybe. Having an outdoor enclosure for an indoor cat can certainly enrich their lives and have them potentially more engaged with their environment. More engagement for you will help as well, and that's having more play time with your pets. Rotate different toys that your cats can passively play with, but most cats will enjoy playing with feathers on a string, mouse on a string, lasers, different exercise things, which gets them moving, and the more exercise they do, the more likely they are to go to the toilet and keep emptying that bladder, but also the fitter they are, the more likely they are to move around and the less likely they are to sit around underneath the bed for 10 hours and accumulate more concentrated urine, which causes troubles. There's supplements that you can use to reduce the stress in cats' lives, and that's dietary supplements like tryptophan can help with an anti-anxiety effect. The dietary supplement Zilkine is a very good mild to moderate anxiety treatment for cats, and that's well tolerated and palatable. It's a hydrolyzed milk powder which you can mix in with food for most cats, and it's quite palatable, so that can help. Some cats with high stress, we do use prescription anti-anxiety medications as part of their treatment program, but it's really trying from as many angles to attack the problem as much as possible by making their lives happier and healthier, essentially. But sometimes you will need to involve your vet in asking the right questions about what's going on in the house, or even a veterinary behavioural specialist is a good idea. There's certainly medications that your vet can sometimes prescribe for idiopathic cystitis, including injections that we usually use for arthritis treatment in both cats and dogs. Glucosamine supplements can sometimes, we think, help with bladder wall lining integrity, and the bladder should have this little glucosamine-rich mucus layer that's protecting it, and sometimes glucosamine supplements could help. Omega-3 oil supplements in their diet, like fish oil supplements, could have an anti-inflammatory effect and could help. But really it's a multi-pronged approach. We don't want medications to make cats' lives worse or more stressful, so usually it's trying to get supplements that are easily palatable and don't impact on their life, because we're trying to make their lives happier rather than more stressful. A really big topic, a really big subject, but if you've got a cat that is peeing places where you don't want it to, it's a really big impact on your life as well as your cat's. So I hope that discussion helped, guys. Thank you.